The number of COVID-19 infections in the country continues to increase. In the last 24 hours, 62 more people have tested positive, with 59 being Kenyans and only 3 foreigners.
We have tested 2,293 samples, out of which 62 people have tested positive for COVID-19. This now brings to 1,348 the number of those who have so far tested positive, and the total number tested so far stands at 64,264.
Health Chief Administrative Secretary Dr. Rashid Aman said the infections were distributed in various counties across the country, including Nairobi with 23 cases, Mombasa 16, Kwale 8, Kiambu 6, Kajiado 6, and Kitui 6 cases. In Nairobi, the cases were recorded in Umoja, Kibra, Eastleigh, Dagoretti North, Lang'ata, Westlands, Starehe, and Embakasi East. Mombasa's coronavirus cases were confirmed in Changamwe, Jomvu, Nyali, and Mvita, while in Kwale, areas affected are Msambweni and Lungalunga. Kiambu, Lari, and Ruiru have reported cases. Kitui's cases were all from Miambani, and Kajiado's infections recorded in Kajiado Central and Kajiado East.
The true picture of this disease in our country will only be known through the tests we are currently conducting.
Testing is voluntary. We cannot put a gun to your head and tell you that you must be tested for COVID. Then testing is happening all over the country. So it will be very difficult to be able to say County X give us this number, County X, Y give us this number. This will just lead to falsification of the numbers, and it will not be informative.
The Minister of Health appealed to members of the public to present themselves for COVID-19 screening.
We have also noted that some of our people have been shy to present themselves for testing for fear of the treatment cost. The position of government on this matter is clear. For avoidance of doubt, let me restate once more. The cost of testing, quarantine, and treatment in a government facility will be fully met by government.
Meanwhile, 3 more patients were discharged after recovering from COVID-19, raising the total recoveries to 405. This brings to 891 the number of active cases being monitored in COVID-19 isolation and treatment centers. As the number of COVID-19 cases in the country continue to increase with increased sample testing for the virus in the country, the Minister of Health insists it's still being frustrated by those providing inaccurate information during testing for the virus, saying the move is frustrating contact tracing of those who might have been exposed to the virus. Purity Museo, Channel 1 News, Nairobi. Take 2, please. We don't mind.